Today we're going to demonstrate how to position for sternoclavicular joints or SC joints. We will start with the patient prone. You can do this erect as well. I already have a shield on my patient. I have a 10 by 12 image receptor in the bucky. I am going to use a 40 SID to the bucky, and then I am going to collimate to a 6 by 8 collimation. I'm going to place my marker. In this case, I'm going to use my left marker in this collimated field. And what I would ask my patient to do is put their chin on the table and both arms forward. This way there's no rotation. We want to make sure that the joints are evenly spaced on your film. If you're doing unilateral, you would ask the patient to turn their head towards the affected side. So if the joint of interest is the left, I'm going to ask the patient to put their left cheek on the tables while still having their arms on the table. Once I have everything in place, I'm going to look for T3, and I can kind of gently touch the jugular notch in the front of the patient underneath and pretty much know that that's about the level that I want to be at. Going to adjust that. And then I'm going to ask the patient to hold their breath. Our next projection for SC joints is going to be the oblique. And for that, I'm going to use a collimation of 6 by 8, still a 40-inch SID. I'm going to do an RAO. And for the RAO or the LAO, I just want to oblique the patient between 10 to 15 degrees. That's about it, right there. If I'm doing an RAO, the joint of interest is the right side, the side closest to the IR. I am still going to be entering at the level of T2, T3, and just want to see what. Move my central ray so that it comes out towards the downside, which in this case is the right side. Obviously, if you are doing bilateral, you would do the other oblique. In this case, it would be the LAO. And this time, the joint of interest is the closest to the IR, which is the left side. I am still collimated 6 by 8. I am still entering at the level of T2 through T3, and I just want to exit through the joint of interest. That's it for SC joints.